Hello, everyone. Just as Zoom does its thing and lets people trickle in, I just wanted to welcome everyone to our webinar, Understanding Those Affected, where healthcare and audience intelligence meet. We've got some incredible insights for you here today. I really can't wait. Well, I can't wait personally to see them. I've seen them in brief, and I can't wait to see all these insights in full. So yes, and one thing to remember is that we have a Q&A box. I don't know where it'll be on your screen somewhere, but please do pop your questions in as we go. We'll be answering as many of those as possible. So even if you think this is a silly little question, we definitely want to hear from you and answer it, or even a comment or something in the chat. We want to kind of foster that back and forth here at Pulsar, where we can kind of learn from each other or learn specifically what we want to know. So yeah, without further ado, I'd say let's dive in. I just wanted to say that all of the topic you'll hear today is about data that's been taken using Pulsar. So what is Pulsar, for those of you who aren't familiar? At Pulsar, we gather conversational data from all across the internet, such as social sources like Twitter, Instagram, Reddit, TikTok, Pinterest, and all that, and many, many, many more. We also have international platforms such as WeChat, things like this, Weibo. We also have other sources such as Google Search, online news, broadcast news, TV, podcasts, radio, all of those, so forums, the lot, blogs. So we're all about offering the opportunity to kind of see the conversations on the internet and realize the impossible task, which is reading the internet. So this allows brands to kind of analyze their audience and its sub-audiences, as well as answer discrete audience-based questions. We offer all that in our platform, and we also have an in-house research department that works as a consultancy. And I guess that's a great time to hand over to our speakers today. Danny, would you like to introduce yourself first?
Yeah, hi everyone. My name is Yordanka, but most people call me Danny. I'm a research manager at Pulsar. I've been with the business for around 4 years, and I participate in the write-up and designing of methodologies around the research that we do at various levels. And today, when initially Sal and myself were talking about what to present at this webinar, we couldn't really stop at a specific case study or approach. So what I'm going to do today is kind of show you a mix of what we have done, our main kind of methodologies and approaches. This is in no way really an exhaustive list, but it's kind of the major research and approaches that we have, and trying to take you through that in 15 minutes or so.
Amazing. Thank you. Thank you so much. And Sam.
Thank you, Sal and Danny. I'm Sam Martin. I'm a digital sociologist and social data scientist who's been using Pulsar for quite a few years now. I first started using it for my PhD and then brought it with me to the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, where we used it to analyse maternal vaccines and the discourse across 16 countries, which we found Pulsar quite versatile in doing so. I'm now working at the Oxford Vaccine Group and the Oxford Ethox Centre, as well as University College London and the Rapid Research Evaluation Lab. And we are looking at things like the mental health of healthcare workers, as well as long COVID, and it's long COVID and the complexity of symptoms that we'll be discussing today.
Amazing. You can see why it was quite hard to put your digital sociologist and data analytics consultant at the real lab, because there's just so many places that you work with, so much interesting research that you do. So yeah, so that's a very tiny one, but you gave us the elaborate one. Thank you so much for that. And without further ado, then I guess I'll hand over to you, Danny, who's going to take over the first half of our webinar. Yeah, I'm going to hand over screen control. So everyone, this is new for all three of us today. We're doing a remote control swapping of the PowerPoint. Okay, so I want patience if this doesn't go well. I'm sure it will. All right, I have given you control. Off you go, Danny.
Okay, so first off, I'm just going to start saying that, of course, as Sal mentioned, the kind of the basis of our data and research is very much Pulsar, so very much kind of social and different online sources, but we also use kind of a mixed kind of methods to support our analysis as well, including kind of web search as well as clients' own data, so first-party data. As well as some GWI kind of data. So I'm and so I click through. So if you don't mind, just click the next slide. Right. So starting off with the first approach and the more kind of typical that we use in our healthcare analysis is landscape. If we could just go back one slide. So landscape analysis is more about understanding the conversation, kind of who participates in it, topics of interest, particularly kind of in specific healthcare spaces, conditions, etc. So this is more of an exploratory approach. Most of the time, it can be more specific as well, but usually clients go to this with just wanting to know what is happening in their healthcare space. And this includes kind of various types of analysis, including evolution of the conversation, as well as, again, who participates in it, what are the sources of information, languages used, etc. So next one, please.
Hi, everyone. I think there's been a little technical difficulty with the slides. Can you hear me here?
Hi, hello, yeah.
Hi, I think there was just a little technical difficulty with the slides. I'm just
Yeah.
going to change that again. You can hear me, okay?
Yes,
Yes.
can do.
Yes, we can.
Then that should be it. Here we go.
Sorry, I got scared for a second that my internet crashed.
No, it's okay. I think maybe someone's internet crashed. I think maybe it's this remote control thing. I told you, everyone, that this remote control thing was a little bit prohibitive. Is the remote control working now, Danny?
I think so. It switched twice, right? Okay, cool. So
yes, amazing.
Starting off, I'm going to just showcase a few. I think there's a little bit of a lag, but a couple of slides from a study. We explored a kind of conversation around gut health and digestive issues. So really the client's purpose here was to understand generally the conversation, but also how to kind of target resources to provide more scientific-based information and understand what the key sort of unscientific or unverified treatments for different conditions were. So starting off, the analysis is, as we said, more of a kind of look into how the conversation evolves or interest in the conversation evolves. Typically, we start this more with kind of a look into the social conversation, but in this case, we're looking at kind of the evolution of interest via web searches. So we see some information on Google Trends, very much a large uptake in interest in gut health, but also using kind of Pulsar tools on the side to understand the key questions people are asking around gut health and finding out that really what are the most popular questions, or what is really the impact of gut health on overall well-being and what really is its importance, as well as how to kind of measure it and improve it. So I'm trying to switch the slide, but I don't think it's happening. Oh, it is happening. It's just
I think there's a lag. Yeah.
Okay,
there's
cool.
Just a little bit of a delay.
Cool. Noted.
So sorry.
That's fine. So kind of kicking off here, we're trying to identify the key topics. So we see actually unverified treatments, which was the client's main concern, are very much the top topic of conversation. We also see kind of the different levels of engagement all of them get. And interestingly, with bad foods for your gut health, or what is classified by the conversers about foods, we see that it's not necessarily the most kind of prominent topic around either posts or engagements, but it does, those topics kind of receive the most engagements per post. So very much kind of reactive conversation as well. Just waiting here for the next one to appear, but we also—
So funny, you kind of have to do your own, you kind of have to preempt yourself here. I'll do the space bar. There we go.
Yeah, so just looking at more the conversation over time, sometimes this is more of a linear analysis. In this case, we're looking at quarter on quarter. So very much like the seasonality of the conversation. And we identified that calendar moments and events around awareness are very prominent and kind of have a high impact on the conversation around medical conditions. So in this case, for example, we can take IBS Awareness Month, etc. So through this sort of temporal analysis, we identify kind of the key moments of this conversation, or key moments where clients can participate in conversations. Next, we're also able to identify the key conversations and concerns for specific channels, what we describe as like row of channel, what the top topics are, what people are sharing most, etc. So in this case, for example, we see Twitter is very much a channel used to deploy research and awareness campaigns, whereas TikTok is kind of a more patient-led, more intimate space to share personal journeys and experiences. And we also can look into kind of what specific types of content, like what does the content look like in terms of formats, in terms of language, in terms of images shared. So if we look at Facebook and Instagram, for example, there is a lot more sort of product and aesthetics focused content and imagery shared, very much housing that narrative of kind of unverified treatments, you know, juices and health teas, etc. Whereas we see obviously with Twitter, there's kind of more kind of focus on clinical and medical data being shared. We see actually using here GWI data, we look into people who have gastro conditions and their use of social media, both those who are saying that they would actively consider advice and information from online sources, as well as kind of the general population. And we see very much across channels, the most active sort of engagement format is video content. So whether that's creating video content or engaging with video content across all platforms, that is very much the form that they all take interest in. And finally, from this case study, we are able to kind of segment the conversations in terms of the various interest groups who participate in it. And within that, also kind of look at specifically their concerns, what information they need, where they get that information, etc. A whole, very much this broader analysis in a much more granular level. So again, kind of, I guess, the point here is coming from that very broad look into what is going on trend-wise in the conversation, and then kind of arriving this more granular look at specific audiences, what are the important topics for them, how to approach them, what are their attitudes and preferred formats of engagement. And in line with that, one of the other major approaches and methodologies we have experienced is patient journeys and profiles. So understanding the journey stages, the key needs and attitudes and behaviors, as well as patient personas. And with journey stages, we tend to see kind of this can be the more traditional, so it can be pre-diagnosis, diagnosis, treatment, cure or remission, etc. Or it could be more of a temporal analysis where we have a condition, diagnosis, or event, and then we want to look at people's attitudes and needs at the time of the event, in a month's time, in a year's time. So several different ways of kind of approaching this journey stages conversation. It could also be simply following the stages of a condition, let's say in terms of cancer, which is an area we've done quite a lot of research in the different stages of progression of cancer. So just a few examples here. Already mentioned kind of the more temporal analysis. In this case, we're looking into carers and patients, kind of communities we've segmented through keyword filtering and tagging, but looking into their kind of emotional responses and attitudes towards heart attacks. So a patient receiving a heart attack, during kind of just after the event and years after, etc. So we identify, for example, here very much a prominent link between guilt and control, and taking responsibility for, first of all, and experiencing the condition, but also kind of the health journey afterwards. Another example of this is already mentioned cancer, in this case, looking at ovarian cancer, the more traditional look from diagnosis to treatment in different stages, but also subcategories where we have people awaiting diagnosis, receiving diagnosis, or making kind of treatment decisions. And also identifying at each stage what are the key things and emotional responses people think about, but also what do they do online? So what advice do they need, where they search for that advice, and also what how that informs their decisions in later stages. And with all those combined, so this is still the cancer ovarian journey, the persona bio here highlighted here is a family first patient who kind of expresses concern throughout the stages around prioritizing care responsibilities, not being able to care for family, as well as being more reluctant to stick with treatment or really acknowledge treatment in that acknowledge the condition, then seek treatment because of not wanting to be a burden, etc. So identifying what the key issues are, what the key needs are, also turn to for kind of support and information seeking. And here, for example, we identify some of the key issues. As we said, this patient, for example, is less likely to stick with their treatment plan or checkups. So obviously we want them to be encouraged to do so. And we suggest a potential way of doing this is like either campaigning or individual contents or peer-to-peer kind of formats that we see on TikTok, for example, from the previous case study. Kind of focused on the treatment allowing more time with family, and also kind of preventing that being a further burden once the condition kind of evolves. And finally, in this one, just going back to that temporal analysis, another profile of blessed survivors, so people who whose attitudes towards the condition is very much that of being out of control, of both their infliction, but also kind of their healthcare journey. So either this is designed to more divine powers, their treatment and their survival, but also kind of the medical professionals, there is slightly less responsibility and accountability taken for the health journey themselves. However, they are very much reliant and trust HCPs and doctors. So again, another approach to disseminate research or kind of improve the health journey of these patients is perhaps through their healthcare professionals. Coming to services and treatments. So again, this is kind of the response, reception, evaluation, and adoption of different services and treatments. So I think quite linked also to personas. But again, what are the barriers? What are the needs? What are the gaps? And this could also be sort of a look into specific pharma companies and attitudes towards those. In the first instance, in terms of case studies, we often look into kind of sentiment, which is usually, well, is AI generated in our case, across your services or treatments. And in this particular case, we're looking kind of more regionally, so what are attitudes around secondary care and cancer care in the UK a few years ago. This is particularly the context is during the pandemic, so very much a lot of negativity around backlogs, etc. But there's also more specifically, when we deep dive, more specifically concerns around variation of advice between practices and different doctors, as well as a very prominent need for mental health support. So again, kind of identifying the broader sentiment, but also being able to deep dive into very specific contents, and again, with the context of the times, zeitgeist around COVID, being able to sort of deep dive into other more specific issues. In terms of treatments, this is looking into patient conversations around hemophilia treatments. So very much looking into what they talk about most, and generally what their attitudes are towards different types of treatments of hemophilia. For the most part, we see patients discussing kind of their daily use of treatments, their kind of barriers, their experiences, their sharing of information and advice on how to take treatments, or how to, get control of injections, etc. But we see, for example, here gene therapy is in third place, but we also in the same study looked into HCP conversation around treatments, and we saw the gene therapy is actually the most talked about, in which case HCPs were more likely to discuss kind of innovation of treatments and improvements, etc. So a bit of a discrepancy between the two audiences. Kind of the main point of this particular research was to understand what motivates people, as well as HCPs, to kind of switch treatments or recommend switching treatments, as well as what prevents them from doing so. So for patients, we see unsurprisingly recommendations from HCPs and kind of experience-based information from peers, so fellow sufferers, being very much prominent motivators. But then in terms of barriers, again, not very surprising, but cost and availability, as well as eligibility criteria. For example, on the NHS, there are a certain number of treatments that are recommended and available, whereas perhaps more recent treatments or treatments in development are less accessible to people. And just wrapping this up, I know we've spent a few minutes with the technical issue, but again, this is not an exhaustive list, but a few more approaches here. We have evaluations of campaigns and events. So again, if you have campaigns around awareness, or if you want to monitor conversation around conferences, like health conferences, we've done so for hemophilia conferences, for example. Trends, we also use our proprietary virality model to assess trends. So are they kind of sustained? Are they rising, etc.? And particularly we have experience doing so in kind of the food and food safety space, as well as around vaccination. And finally, kind of a more interesting methodology we've done as well is around misinformation, particularly around COVID. And in terms of COVID, wrapping up here the list of what is available, or what we have done in terms of methodologies to understand audiences in the healthcare space, I would like to hand over to Sam, who will take you through her academic research around long COVID and how she and her team used Pulsar to aid in that research.
Amazing. Thank you so much, Danny. That is so cool to see all the different pieces of research that would, obviously there's been many, many more, but see as you said right at the beginning, we really struggled to pin down exactly what we can talk about today, because there's just so many things to talk about Pulsar for healthcare. And so that was a really great snapshot into loads of different pieces of research. And please do, if anyone had any questions that came to mind during that, pop them in the Q&A, and same as for Sam's presentation shortly, please pop any questions that you have, big or small, into the Q&A. We'll be happy to answer them. But with that, I think I'll hand over to you, Sam. I'm now going to give you the remote control. I know that there was a moment where it didn't work, but it seemed to work for the rest of the, I mean, hats up to it. It seemed to work for the rest of the presentation. So I'm handing over to you now. And yeah, here you are. Thank you, Sam.
Thank you, Sal, and thank you, Danny, for a really interesting presentation. I'm certainly going to take some notes for our future research too. And leading on to the research that we've been doing here at University College London with the Rapid Research Evaluation and Appraisal Lab, we've been using Pulsar to do a form of what we would call abductive qualitative analysis. So collecting data using Pulsar, identifying patterns, developing a hypothesis, retesting that hypothesis, and perhaps going back in and collecting more data. And I'll show you a little bit about how we went about that by looking into long COVID and the complexity of quantifying symptoms in adults and children with this, what is now being called a chronic illness. Let's see if I can go to the next slide. Brilliant. Okay, so when we first started off with the research, we were just going to look at long COVID in adults and specifically look at healthcare workers' perceptions of either getting long COVID themselves or treating long COVID. But while we were doing this analysis, we actually came across a subgroup of healthcare workers that were also talking about children and young people developing long COVID symptoms. And we found that looking at this together would help us gain more insight into the emerging knowledge on long COVID and trying to identify critical areas and future directions for researchers and policymakers. So I must say at REAL, we also do consult with the NHS, and we consult with Parliament, and the post-it questions going to Parliament as well. And we usually, because of the beauty of using Pulsar, we use a mixed method approach where we do a discourse analysis of what's going on social media. We do a comparative analysis with interviews and focus groups. And then we develop a coding kind of equation where we create Boolean search terms that look for keywords coming from the initial interview and focus group analysis. And then we use that as a tool to look at what's going on in parallel on the internet. So we look for sentiment, emotion, image analysis, text analysis, and segmentation analysis, which I'll show you a little bit going forwards. So when we first started off, our main question was, well, how long is long COVID? We wanted to find out, so we started off looking at this as mentions of long COVID started around April 2020. We were able to use Pulsar to look back in time from starting from January 2021. So we looked back in time to start analysing the data, and then we continued to analyse the data up until May 2022. And we found using Pulsar's streaming charts quite helpful, mainly in terms of categorising what were the main keywords and hashtags that were being discussed when people were discussing their symptoms. And we found that what people were trying to make sense of was the complexity, the temporal complexity of having long COVID symptoms over time. So you can see here from this stream chart, we've got people saying, well, I've had long COVID for how many months? I think it's long COVID, not so sure. I've got lots of fatigue. Some people were counting in days, some people were counting in weeks. So what we were able to do from looking at this, this stream chart was figure out, okay, where are the fluctuations in time where people are talking about specific things, versus where things are dying down. So from that, we were also able to click into those streams and get examples of what people were talking about. And you can see here, there's actually a little bit more complexity, because not only are they talking about, here's a doctor who says that they've had long COVID for 12 months, and they're counting this in terms of when they've been diagnosed, and then also in terms of neurological and sleep symptoms. But then you've got other people who are counting it in terms of days, in terms of their access to long COVID clinics, and then also in terms of their frustrations with some healthcare workers who were possibly being dismissive of symptoms because these symptoms were not yet categorized or understood as well as they are now. And then, of course, you have another healthcare worker who's talking about living 10 months with long COVID, how difficult it is to mentally cope with this. And then also talking about the stress in terms of insomnia, linked with fatigue, linked with heart palpitations and tachycardia, etc. So it's quite a complex kind of cluster of symptoms and people sharing their embodied experiences of these. Then we were able to then look at, okay, we just by looking at the text, we were able to feel that there was quite negative sentiment, but then zooming outward and looking at sentiment by volume, you're really able to see just the amount of negative tone of conversation, drawing to quite a key peak between May and September of 2021, when the WHO and NHS England started to really categorize lists of symptoms and start to focus on developing access to long COVID clinics. So you can really see the tide of people talking about this. And yes, there are positive and neutral, and by neutral, we're talking about where people or humans aren't kind of interacting. So they're just like sharing news or text to the rest of their network. And there are some positive aspects of this as well, which I'll go into. In terms of symptoms themselves, this is where we started to have a really good look at what types of other symptoms were being experienced. So you can see that people are talking about breathlessness, talking about fatigue, depression. One of the stronger terms was brain fog as well. And then also, again, classifying how long these symptoms were lasting for, so quantifying in days, months, weeks. But then we also started to see a reoccurrence of talking about children and kids. And this piqued our interest because, as far as we knew at that time, the official kind of message was that children and kids were not getting COVID as badly as adults were. So it was interesting to see discussions of this arising. So we decided to investigate further. And again, looking at in terms of key words by emotion, we're able to see that there was a lot of sadness based around these symptoms. This linked with some of the theories that we were using to discuss this. So in the field of sociology of health and illness, there is this concept of biographical disruption. So when someone is suddenly diagnosed with a chronic illness or they become very ill, there's this disruption into the way that they live their daily lives and how they can cope with this kind of the way that their lives are kind of impacted and how they can go forwards. And so we found that a lot of the sadness, the disgust, and the fear, and sometimes anger, was linked to these notions of people feeling like their lives had changed and they were scared, lost, and confused, and also trying to find out what the reason was behind these symptoms. And then again, we found also that people were talking about children. Now, bearing in mind that when we did this analysis, we did a Boolean search term that was looking for all search terms related related to the widely observed symptoms of long COVID, as well as search terms linked to psychological distress, and as well as terms linked to the vaccine, that was the emerging vaccine back then. And then we did a sub-Boolean search term looking at healthcare workers. So we were looking at the conversation from the perspective of healthcare workers. So we wanted to understand why these healthcare workers were talking about children. Were they treating them? Were they talking about their own children? Were they picking up on topics that were being discussed in the wider social media community? And again, here you can see we quite like using this topic segment or keywords bundle. And this is quite good because it allows us to really see how things are interlinked. So you can see here at the top, we've got this blue segment for fatigue, and that's also linked to questions of time, people feeling fatigue, dark blue again linking to brain fog, and then counting how long that they've had this feeling of fatigue. What we also found was where people were talking about chest complications and tachycardic symptoms. This was the one of the main things was when they spoke about themselves as patients, because these were quite scary symptoms, which meant that they went to hospital. So we're able to kind of link these together and try to dive into more of the data. And again, here you can see children popped up as well. So we were quite interested in this. We decided to do a little bit more of a segmentation analysis. And what Pulsar is quite good at doing is looking at the critical clusters of conversation around these main topics of concern. We decided to write a paper on this, which is in preprint at the moment, called Long COVID Affects Children Too. And we did this as a Twitter analysis of how healthcare workers were discussing this. And we found that 5 of the key conversation segments were around worry about children getting COVID when they were going to school during the pandemic, risk of exposure, and then also sharing experiences of being infected in schools and also trying to manage time off of school. Then we were also looking at discussions where they were talking about the impact on the health of children and young people, and thinking about the long-term effect of long COVID. Would these young people then go into becoming young adults who would be suffering from this chronic condition, and how was society going to be able to cope with this, as well as the people themselves? Then also, as various cases and variants were being reported, we were looking at discussion about the worries around people getting long COVID, getting feeling a little bit better, then getting a relapse if they became infected again. Then the final one was data, and this was really just people quantifying how, when, and how long that they had long COVID for. And so that was quite interesting in terms of the means and the method. So not just talking about things in terms of text, but also using things like wearable technology and tracking heartbeats and things like that when they had quite scary episodes. And then just briefly, we looked at using the tree map function just to see how much each of these topics of concern are being discussed. So this was quite useful in just giving us a really good broad overview, and not only just looking by keyword, but also by looking at hashtags. One of the interesting ones was long COVID kids, and we found that this was linked to healthcare workers who were also discussing organisations that were campaigning heavily for kids' symptoms of long COVID to be recognised by the government. And I'll show you some more data that was being shared in a minute. In terms of sentiment, again, zeroing on children and long COVID, we found that, of course, 99% of the words being shared were in a negative context. and they were mainly associated with hospitalisation figures for children being hospitalised, criticism of the policies that were emerging and whether they protected children adequately enough, and also worry about how different vaccinations, so Moderna, Pfizer, and any others that were occurring, were affecting not only children but also young people, so from late teens to early 20s. And then of course positive sentiment was around community support groups and supports provided online. In terms of emotion, there was predominantly sadness and fear. Sadness in terms of healthcare workers discussing hospitalizations, as said before, and how it was hard to kind of keep their spirits up after treating both adults and children. And then of course we've got joy in terms of people finding the goodness or satisfaction in actually supporting kids with long COVID, and hopefully kind of bringing them to a stage where they're able to better cope with their symptoms and condition. And then of course fear in terms of wanting vaccination to speed up so that children were protected going forwards. In terms of ethics, we use Pulsar's image analysis quite a lot, but because we cannot explicitly seek permission, depending on the ethical guidelines that we're working under, of parents or children themselves, we're not really able to use the images within our publications, but we are able to at least talk about the numbers and talk about the different themes that were shared. I will show you, because we're in a closed environment, some examples, but I have faded out the faces of the children in the images coming. But just to say that in terms of sharing, there were lots of images shared from scientific studies, infographics, visualization. How do you visualize what is mostly an invisible illness if it's not presenting as something quite visible to see? And then also things like chronic fatigue and neurological issues. We found it was quite interesting to see how people were visualizing these on behalf of children. So with the Long COVID Kids organisation, they were very much using infographics, and they were speaking specifically about numbers and data, and trying to spread the message in as detailed a way as they could, going down to the different parts of the bodies that children were experiencing symptoms on. And then in terms of healthcare workers who were sharing pictures of either their own children or children that they were treating with permission of their parents, you can see there were different ways that they were trying to show. So from swelling of knees, from skin lesions, and also in terms of where they couldn't actually show, well, how do you show fatigue, or how do you show brain fog? They were showing pictures of children just lying in a hospital bed looking sick, or lying underneath a duvet, not able to get up for weeks at a time. And again, the more visual depictions were things like COVID toe, lesions on the face, bumps and lesions on the chest, and things like that. So it's quite a hard thing to see, but it's also quite interesting how people were really quite adamant, look, my kid's suffering, we need some help, at the time when there wasn't much help around. And then finally, we were looking at the geographical location of discussion of these symptoms. We found that while there was a lot of discussion around the South and the Midlands, there was also discussion in Scotland. And as far as I know, at least at the time of writing our paper, there weren't that many facilities in terms of long COVID clinics available to people in Scotland. So we were able to suggest that they open them up more widely to, we were able to suggest this to the policymakers, that they open them up more widely. And then finally, just looking at this data in terms of using an abductive analysis process, we were able then to think about what other questions would we'd be asking going forwards. So we're looking at gender and demographics over time, different methods of pacing that people were sharing in terms of how to help themselves kind of cope with chronic fatigue. And then of course, sentiment per gender, topics of concern per gender, and also discussions in terms of, well, how does long COVID look in terms of what kind of profession you have, and how does long COVID look in terms of how people discuss this, not just on Twitter, but on TikTok, on Reddit and on blogs as well. So we do find Pulsar quite an interesting, exciting tool to use in terms of the capabilities it has on in terms of research insight, and also going forwards to look at other things. And that's it. Thank you so much for listening.
Amazing. Thank you so much, Sam. There's a bit of a delay there because I just had to relinquish your control so that I could get control back. Yes, thank you so much, both of you, for your incredible research that you presented there. I'm actually going to stop sharing my screen so that we can see everyone on screen at the same time. Now, you may, attendees may want to, just in the top right-hand corner, you can click view and change it to gallery view. This will mean that you can see everyone at once, which is kind of more conducive to the Q&A aspect of things, which of which we have many queues that I want to be able to get through. Beforehand, I just wanted to say, Sam, such incredible research into such an important topic, because like you said, this is, I think that, I mean, one of the questions that's come in is actually maybe along what I'm about to say, which is that a lot of underrepresented groups don't get also underrepresented in research as well, and healthcare research being specifically, and children are one of those groups. So it's very important that you've been able to do and share this research with us today. I guess let's jump straight into the questions, shall we? I really want to be able to get through everyone's questions, so I don't want to hesitate. We've got one here that says, "This is really interesting. Thank you." And by the way, I realized that underneath my name, it says Pulsar Marketing. That's not my name, though I do love marketing for Pulsar. It's not my only identity. My name is Sal Morton. I logged in from the Pulsar marketing account to manage this today, not my own personal account. My name's Sal Morton. I'm content marketing lead at Pulsar. I'm not just some kind of random person floating through space here asking questions to our wonderful guests. Back to the questions. I'm really curious as how you balance using audience intelligence research for healthcare with ethical concerns. This is an interesting one for both of you. Who wants to go first? You're both being very polite.
Yeah, well, I'll start in my case. I think for some, obviously, there's more considerations as they need to commit to get permissions, etc. But that also means that there are a lot of imbalances anyway. In the case of Pulsar, we also have certifications with the International Organization for Standardization, which is a voluntary organization. So it means we have very strict kind of data compliance policies. But aside from that, in terms of kind of the day-to-day, one of the key things is that we never really focus on specific individual talking when we talk about audiences or kind of attitudes and personas. These are more kind of built as a representation of a group or kind of conversations. We even try when we include quotes, because I think in health research it's very beneficial to have as much quotes as possible, as much as the kind of healthcare patient conversation. Danny,
you're just breaking up a little bit. I think, is that happening for you as well, Sam? Yeah, Danny, you're breaking up a little bit. We missed the last bit of your answer there. I think maybe let's give your Wi-Fi a little 30 seconds to breathe. You've frozen for us there. And Sam, how about Oh no, she's dropped off, but this happened earlier and she came straight back in. It's fine. So yes, about balancing audience intelligence research with healthcare and ethical concerns.
Yeah, so what we try to do is when we're publishing, especially, we anonymize all of our data. So we have some scripts that we've created at UCL where we anonymize all of the usernames. So we take out all of them, we take out all links. We also, if we're going to use quotes, we don't use direct quotes so that they're not instantly Googleable. So we tend to summarize and give kind of examples of what people say rather than that themselves. And we also don't share any of the actual data that we have as well. So there have been a lot of calls for trying to make the data transparent, but we say that, well, we're looking at healthcare, sometimes we're looking at mental health. And so we just need to be able to protect the people that we study for ethical reasons.
That's a really good answer. I really think I love those layers of protection. I think obviously very methodical and very kind of protected research, like one would do with traditional research as well. But obviously traditional research doesn't have the someone's published it online. You know, if you've got a group of people in the room that's not also published online. Oh, Danny's back. Hooray. I wanted to just address a quick technical question in the chat, which is, will we get the slides from today's presentation? So the recording of today's presentation, which will obviously include the slides, will be available to you. I think Zoom will automatically send that out to you after it's done its video processing online. And do get in touch if there's any particular part of the slides that you'd like to look at. Obviously, different people own different parts of the slides, so we'd have to ask on your behalf, but do get in touch if you want to have the hard digital copy, as it were. Let's move on to another question. How do you ensure that your research doesn't leave out underrepresented groups?
I can answer first if you want. What we try to do is we look for all sorts of groups. So we do some initial analysis for, let's say, marginalized groups. So we can talk about ethnic groups, BAME groups, gypsies, older people, men. Depending on what we're looking at, we will do sub-analyses using Pulsar's tools, just so to make sure that we can find not just what is being discussed in general, but any hashtags that are key to those groups. So we found that a lot of the times when we're looking at, let's say that the Twitter bios of people, they don't necessarily identify as, let's say, I'm an Asian doctor working in South London, but they may use a hashtag that is linked to a specific organization. They might talk about Ramadan, they might talk about different things. They might also use not just words, but also specific emojis. So let's say, for example, if you were to look at my Twitter bio, you would see it. I've got the flag for the Caribbean island of Dominica, where my mother comes from, and then other different things as well. And I might also have a hashtag that links to a chronic illness. So I'm a celiac, so I'll do hashtag celiac. So we look at a combination of things so that we make sure that we're including as many people as we can as possible. And we also kind of cross-check that with focus groups and interviews as well, so we can understand what things are being discussed within specific communities we're looking at.
Amazing, I love that. That's a great way to make sure that everyone's represented in your research, is to combine those kind of thinking outside the box emojis, maybe hashtags, but also being able to sit down with people who you in a more traditional way and kind of combine these two research approaches. Amazing. I've got a question for you, Danny. It's from someone called Gloria. Hi, Gloria. Could you explain a bit more about how you were able to connect the GWI data to the Pulsar data?
Yeah, so this often is kind of a case-by-case basis. So obviously in the gut health conversation, we were lucky enough that there was already kind of information and established audience around kind of gut conditions or gut health conditions. So in that case, we were more interested specifically in those groups that are already existing in GWI to sort of kind of support our analysis into what formats they prefer using, what platforms they are kind of more reachable on. So in that case, as I said in the beginning, GWI data is often sort of a support tool for us, kind of informing our research, kind of sometimes guiding our methodology, but also just supporting our analysis in different areas. Oftentimes, more recently, what we've seen is clients will come to us with identified kind of GWI profiles or audiences that they have seen there and they're interested in, and they will ask us to kind of recreate those for social. So there's that link there. In case of recreating audiences in GWI, it's like slightly more difficult because obviously, as you know, that's kind of an existing database. It's not something like social where we collect real-time data. But if we see that it is an existing conversation or like a proxy conversation, so in the case of gut health, it wasn't necessarily people talking about gut health in GWI, but it was people having a condition. So yeah, that's kind of the link there, and how we're trying to more link those two sources and have a kind of more encompassing view of audiences and
Amazing.
trying to recreate different audiences in the two spaces.
Thank you. It's a really comprehensive overview. Thank you. I appreciate that. We've got not many minutes and loads of questions. I'm having to prioritize. Let me see. So Rebecca here says, do you use the hashtags? I think this is to follow on from what you were saying, Sam, about underrepresented groups. Do you use hashtags to collect demographic data to describe your sample rather than rely only on information from the user's profile? So I'll say from Pulsar's point of view as well, is that users' profile data is also only what they've given publicly as well. It's only what they've given to Twitter. There's no kind of demographic data lurking underneath that. There is a lot of inferred or demographic data from audience that is based on a variety of metrics that is linked into Pulsar as well. But I guess I'll pass the question back to Sam because it's a bit more specific. So do you use hashtags to collect that demographic data to describe your sample, or rather than rely on information from the user's profile?
Short answer is yes. So, but also in terms of, let's say a user is signed up on their account and they're based in London. We had a lot of healthcare workers who were redeployed during the pandemic. So sometimes they were kind of moving around, and where the data from Pulsar said they were based, actually there were some cases where they had been relocated up north, for example. So we use kind of hashtags to narrow down where they are at that point in time. But obviously, not in terms of personal data, so we wouldn't be able to say exactly where they were standing, but at least just generally where they are. Yeah.
Amazing, thank you. I'm going to try and like squeeze in as many as possible. Noel says, I would love to have a webinar on how to create this level of data for presentation in Pulsar. Noel, there are Pulsar power-up sessions that you can join. Do get in touch, and we'll be able to put you into that webinar stream, which is kind of how to make the most of Pulsar. So watch this space, and also just please do contact us if you'd like a demo in how to use Pulsar. We can give you one-on-one. We can walk you through exactly what you need to use the platform for. Back into a question. Can you talk? This would be great for both of you. Maybe as a last big question to answer before I just kind of wrap us up. Could you talk a little bit more about how you use keywords from in-person interviews to set up searches within the Pulsar platform?
Okay, well, should I start? Because my answer is probably less comprehensive than Sam's. I think in our case, obviously, we can only use the data that clients provide us with. So this will be a case of where client researcher perhaps focus groups or interviews, as you say, we would ask them, we would have a meeting, or at least a few meetings, to understand specifically the goals of the research, but also approve kind of keywords and metrics, etc., that we want to look into. So this is very much on the client side, what is decided as keywords to look into. Obviously, because interviews are more kind of private and confidential, when they are from the side of the client, we don't necessarily have access to interviews. I think that would be somewhat inappropriate in terms of data protection, but we do rely on kind of clients' research and goals to identify what we put into our searches.
And just leading on from what Danny is saying as well, so our interviews are also private and confidential. So what we tend to do as a research team is actually go through the transcripts offline, and then we tag each of the interview answers with specific themes and sub-themes, and then from those themes and sub-themes and reoccurring kind of words, we're able then to construct a Boolean search term and put that into Pulsar, and then go from there.
Amazing. Thank you so much. I know, everyone, that we've gone over our deadline by 1 minute. I'm very sorry about that, especially as here in the UK it's 5 p.m. I want to make sure everyone gets their evenings. But I just wanted to say thank you so much, Sam and Danny, for joining us today and for presenting your incredible research. It's so interesting, and it really excites my brain. We were saying just before this webinar, it's very exciting material, isn't it? Well, yeah, thank you for joining us. And if anyone else has any other questions that didn't get answered today, please do just reach out to us. We're very nice people, and we can point you in the right direction and answer your questions. No worries. And yeah, I think the one last thing to say, one last huge thank you to Sam and Danny. Thank you so much. I wish I could give a round of applause for everyone that's on the stream.
Well, thank you, Sal, for hosting. This has been super interesting, and thanks, Sam, for participating. Your research is super cool to see.
And thank you to Danny as well. Your research is really cool. I'm going to look more into it. And thank you, Sal, as well, for hosting. It's been great. Really good.
Oh, thank you so much. Look how wholesome this is. This is wonderful. I'm going to close the webinar now, otherwise we never will. But I'll see you all again soon on our next webinar. And Sam and Danny, thank you once more. Thank you. Bye.
Thank you.
Bye.